Cantilever 101. So if you're an engineer, this is probably a big repeat for you, but for anyone else, in engineering, cantilever forces destroy things. And engineers work really hard to try and avoid cantilever forces. So what is a cantilever force? A cantilever force, let's just use the old traditional example of a teeter-totter at the playground. So a cantilever force is an unsupported piece at the edge of a structure. So in this case, a teeter-totter. If you are to put a force on one side of the cantilever, what happens on the other side? It goes in the direct opposite location. So if you have two people equal weight sitting on either side, the forces are balanced. But if you have only on one side, there's tremendous force on the other side. Now let's say we move it to here and we put equal force here. What do you think happens here? You have a greater increase in cantilever forces. Now, why do I bring this up? Because cantilever forces in full arch implant dentistry is critical. It is a huge determinant on the success of the case. So in your traditional all-on-4, let's draw a maxilla. In your traditional all-on-4, let's say the patient has really big sinuses, really big, and we want to avoid those sinuses. We're going to place the implants further forward. But the patient says to the doctor, hey doc, paid all this money, I still want to get all of my teeth. What is something the doc could do? Well, when he makes his teeth on top of the implants, he or she can then just add more teeth onto the prosthetic. And the prosthetic starts to look really long and far away from the final implant. And this distance, the farther the distance that it goes away from the implant, the larger the cantilever force. So when a patient chews with their back teeth, which is what they're gonna do, what do you think happens to this implant? It takes on significant load. And the more if this is going this way, then the force is going up onto the implant, what is gonna happen over time on this implant? You're gonna get bone loss around the implant, which over time will just worsen, or you're gonna get a screw loosening. The prosthetic connects into the implant. That screw that holds it in is gonna loosen. And if that's not corrected, you're gonna get bone loss. So cantilever force is the problem. It is the biggest problem with full arch implant dentistry. And the biggest issue is that the docs only know how to place your all-on-4 and they can't solve this. How do you solve this problem? Number one, you add less teeth. That's the simplistic solution that a lot of docs do. Patients either are okay with that or they're not. Or what the modern generation of doctors are doing to solve this problem is they're placing pterygoid implants. If you place a pterygoid implant in the back of the mouth and you attach to the prosthetic, what cantilever force is there? There's none. So the best way in solving cantilever force is A, never creating in the first place, or B, solving it by adding support on the other side of the cantilever. And that's why the modern docs are focusing on pterygoid implants, because it's the best way to limit cantilever. And if you limit cantilever, you're decreasing the risk of screw loosenings and bone loss on the posterior implants in your classic all-on-4. I hope that explains cantilever and its effects on full arch implant dentistry.